audience. So my speech is over proper hygiene in day-to-day life. In 2019, 10.2 billion people saw their physician for infectious or parasitic diseases. Proper hygiene is an easy way to help decrease this number. In this speech, I will go over why proper hygiene is important to not just you, but those around you. I will demonstrate different practices you can do in public and at home to help fight the spread of sickness. We will first dive into why proper hygiene is important. We will start off with the question, what is hygiene? You may have heard it as showering, brushing your teeth, etc. However, based upon a definition from the Oxford Dictionary, it is said to be conditions or practices conducive to maintaining health and preventing disease, especially through cleanliness. For this speech, we will focus on the first part of this definition, maintaining health and preventing disease. Proper hygiene helps prevent the spread of diseases between people. By washing your hands, you can prevent yourself and others from getting the sickness nobody wants. For example, influenza, which is common around this year. There are many different types of diseases that can be spread in different ways, so we will take a look at why knowing these are important. Airborne diseases are those that can be spread just by inhaling the pathogens from someone who is sick, says Healthline 2024. They are easily transmitted due to them traveling in the air. Just a simple cough, sneeze, or even talking close by can get you sick. Some examples of airborne diseases are COVID-19, influenza, the common cold, and even chickenpox. The worst part about these airborne diseases is that all you can do is rest and drink lots of fluids. There is no quick fix. You have to ride through the sickness. According to News and Health, airborne diseases can travel up to 6 feet in a room and stay in the air potentially for hours. Now we will talk about droplet diseases. Droplet diseases are spread by coughing, sneezing, and potentially breathing hard, and releasing body secretions such as spit, mucus, etc. They can be spread by inhaling the droplets, touching a surface, and then your face, and even just from droplets landing on your face, says Texas.gov. Some of the common diseases are influenza, RSV, and measles. Let's see how you can help. You can practice hygiene out in public in many ways. The first and most important is washing your hands. I will now inform you on the proper way to wash your hands according to the Cleveland Clinic. I have a visual aid available for you as well, which is seen right here. First, wet your hands with clean running water, and preferably warm water if available. Next, apply soap and rub your hands together for at least 20 seconds. If you do not want to count, a trick I learned doing CNA clinicals was to sing your ABCs. Make sure you wash your hands thoroughly, scrubbing in between your fingers, your nails, and on the tops of your hands. Make sure that your hands are lower than your forearms to prevent contamination. Rinse your hands until there is no soap left. When turning off the water, use a paper towel or your elbow to prevent contamination. Lastly, dry your hands with a clean towel. If you do not have access to a sink, you can also carry an alcohol-based hand sanitizer. It must be at least 60% alcohol to be effective. You will apply hand sanitizer the same way as when you are washing your hands. The only thing is make sure you rub them together until dry. You want to wash your hands or use sanitizer whenever you touch your face, are cooking, before and after eating, after using the restroom, etc. Another way to practice hygiene is always covering your mouth when coughing or sneezing. The first option is to sneeze or cough into a tissue. That way you can easily throw it away and then go to wash your hands. However, if that is not an option, you can sneeze or cough into your elbow, then immediately wash your hands. That way your cough/sneeze is concealed and the droplets will not have a chance to acquire someone else. Lastly, do not share personal products such as drinks, chapsticks, toothbrushes, etc. When sharing these personal items, you risk the transfer of germs and you potentially getting infected. Now let's talk about what you can do at home. You can help fight the spread of diseases at home too. You should be disinfecting surfaces in your home often, especially those that are frequently touched, says the CDC. You should be cleaning high traffic surfaces such as doorknobs, light switches, and countertops regularly. You should also deep clean after visitors. You will want to clean these surfaces with something such as soap and water first. Then you will sanitize and disinfect. You can do this by wiping the surfaces with a bleach solution. Make sure the cleaning solutions you use are appropriate for the items you are cleaning. If someone in your home is sick, you need to be sure to clean everything they've touched thoroughly. Clean their bedding, clothes, and any high-touch surfaces, says Upstate Medical University. Make sure you are washing your hands often to rid yourself of any germs acquired while cleaning. Based upon this information, let's do a summary over what we've learned. Proper hygiene is important to prevent the spread of diseases. You can practice proper hygiene by washing your hands for at least 20 seconds, applying 60% alcohol sanitizer to your hand when hand washing is available, covering your sneezes/coughs, and cleaning your home with the appropriate materials. You can prevent the spread of germs by applying everything we've learned. You can help save lives, one hand wash at a time.